Good afternoon, and thank you for joining me for Leadership Rounds. I'm Dr. Mindy Estes, President and CEO of St. Luke's Health System in Kansas City and AHA Board Chair. This week, I'm really pleased to be joined by Claire Zangerle, Chief Nurse Executive for Allegheny Health Network in Pittsburgh. Welcome, Claire.
Thank you, Mindy. It's great to be here.
You know, Allegheny Health is an integrated network within Highmark Health that comprises 12 hospitals, surgery centers, cancer centers, and health and wellness centers, as well as primary and specialty care clinics, outpatient facilities, and post-acute services, a truly integrated system. Has a workforce of more than 21,000 and serves patients in 29 counties in Pennsylvania and portions of New York, Ohio, and West Virginia. As the Chief Nurse Executive for Allegheny Health Network, Claire is responsible for the practice of nursing across the continuum, serving as an executive nursing voice for the network's more than 3,000 nurses. Before coming to Allegheny in 2016, Claire was CEO of the Visiting Nurse Association of Ohio, where she led the state's largest independent nonprofit home health and hospice provider. Prior to that, she served in various capacities at the Cleveland Clinic, including Chief Nursing Officer. Claire is a fellow board member with me of the American Hospital Association. I'm really grateful to have her join us. So Claire, if it's okay with you, let's just jump right in.
Okay, let's do it.
So we have been hearing for the past several weeks about cases of COVID surging across the country. How is Allegheny Health positioned to battle this third wave of the pandemic? I've lost count, but I think it's the third wave. And what, if any, are the lessons your team learned earlier this year that are helping now?
You know, Mindy, we've done a lot to prepare for, as Dr. Fauci calls it, surge upon surge. First, we listened to our staff. What experiences did they have in the first surge and through the summer? What did we do right? And really, what could we improve on? Early in the pandemic, we were ordered to cancel all the non-essential surgeries, but we don't think that's going to happen again. So in this surge, we're making sure that we care for ongoing patient needs in the face of COVID, making sure that patients still carry on with their regular healthcare needs. We have to continue to manage those needs, and we've put processes in place to do that, such as telehealth, adjusting how we use our space, and ensuring we have enough ventilators and dialysis machines. And of course, we also have to ensure that we have adequate supply of PPE. So with the quality of PPE evolving, we've actually readdressed that. So one example is face shields. So the first iteration of those face shields were not as sophisticated as the ones we have now. So we went from the forehead foam to the eyeglass type. And honestly, that's because we learned from the staff what they wanted. We just asked them. And these newer versions will certainly also increase compliance. You know, we've been aggressively expanding our PPE stockpile and are confident we're in a pretty good place going forward, but we absolutely monitor our PAR levels every day. We're also fortunate that we get to work with this really great company within Pittsburgh, MSA of Pittsburgh, and they've reapproached a segment of their operations to work with us to produce N100 masks. So I think another thing I want to mention too is what we learned in the first surge is that the less people we have around in the hospitals and in the ambulatory clinics, the better. We figured out how to balance staff that can work from home, which was hard for our staff because they've never really worked from home. They feel more comfortable being in the facilities. And then we have those that can work on site that really have to be on site. So we've put in like rotating schedules to reduce isolation of employees and preparing our physical spaces for our employees to be able to be farther apart, and for our staff, and distancing chairs in the cafeteria, those types of things. Just keeping our staff safe at work it's not just about PPE, but it's about a lot of different things.
Yeah, you know, we found we sent a lot of people home to work remotely, and it is a journey, and we're learning how to manage remote work, how to have connections as you work remotely. And I think remote work is one of the lessons of the pandemic that will be here to stay.
Right. I agree. It's not a bad thing. It's just something people have to get used to.
Absolutely. So when we look at critical issues like staffing, testing, or supply needs, which really are the three cornerstones of this pandemic that we've been battling since the March timeframe, what should hospitals or health systems be planning to get through the next several months? And what are your biggest concerns as you think about your workforce?
Well, first of all, we should all be offering as much as we can in appropriate testing to our staff in the communities. And it's dependent on supply, of course, but making the effort is really part of our mission. And, we must focus on those vulnerable communities in terms of testing. And we're doing that now with our mobile units at AHN. But if we don't focus on vulnerable communities, then we're not actually getting to some of the really the crux of what needs to be done. And in terms of the workforce, I have two concerns about my staff, really, to be honest. One, there's not enough of them, and they're always on, and they've always been on during the pandemic. But even before the pandemic, there was a national nursing shortage, and the pandemic just made it worse. And in the most recent surge, many of our frontline caregivers are contracting the virus in the community. And in some cases, we're losing nurses to hotspots because they're leaving us to go work there. We have to remember that our workforce is human too. They get exposed just like the patients. They go to the grocery store. They have to fuel up their cars. They have to do everything normal that everybody does. But if I could put all my staff in a bubble and protect them, I would, but that's just not our life. But I'm worried that once we get on the better side of this, they may walk away from the bedside. I am worried about that, but I'm doing all I can to prevent that from happening because honestly, the staff that we have right now are the backbone of our health systems.
Have you seen a recommitment to nursing from your staff?
I have. People have asked me, have people decided, look, I'm not doing this anymore? I think I've maybe heard one or two of those, and they're mostly toward retirement age. But I have seen a bit of a recommitment to the staff because we are still committed to our staff. And they don't feel that this is anything that they can't handle. People are calling them heroes. People are elevating them, but they're saying, this is my job and I can do this. They're tired. We know they're tired. But they are committed to seeing this through. I think at this point, it's almost like we've done this for 9 months. We're going to keep going until we're on the other side.
Well, we're all tired, and we talk a lot about COVID fatigue, and it really is important to keep our workforce resilient and buoyed during this time, and what will likely, I think, unfortunately, be a few rough months to come, well into 21. Give me some examples of how you're working to boost resiliency among your staff.
Well, first of all, we're listening to our staff. And I think that's really what they want. They want us to listen to them, to give them what they need. And we work very hard to give them what they need, whether it's limiting visitors to make them feel safer, or it's, switching out the foam mask shield for the eyeglass shield. Those are important things. We also have done things for them that they wouldn't ask for. So we know they need a break. They're in their shift. They need a break from the floor. We've created at every one of our facilities the relaxation rooms that vendors have put different amenities in, and donors have put different amenities in, like relaxation chairs, meditation tapes, aromatherapy, tons of snacks, so that they can get off the unit and decompress. Because going into just a general regular break room on a nursing floor doesn't really give them the restoration that they need. So that's important. And as much as we try to stay away from throwing money at things, I do think that by offering them incentive pay when they pick up extra shifts, that makes a difference to them. It shows our commitment to them that we're committed to you. Yes, we do have to use agency, but you know what? We want to give you some money to do this as well. So I think those are things that our staff have responded well to and appreciate.
we know in sending our own nurses to work is something I think that we've done, and it is a balance between needing agency but being sure that we invest in our folks, because they know our facilities, they understand our culture, our mission, and they will be there when we come out on the other side of this pandemic.
That's right. That's right.
Now, we know that hospitals and health systems are educating local communities about COVID spread. That really is obviously one of our jobs, is to provide, accurate health information to our communities. But can you talk about why it's important for caregivers to personally take on that challenge as well?
Yeah, I think our community, our citizens of our communities look at our caregivers and as examples. They look to see what their behaviors are. If one of our caregivers is in a pair of scrubs, picking up dinner on their way home from work at a restaurant and they don't have a mask on, that may make the community say, well, that's not so important. So it's important for our caregivers to be those examples in the community so that we're spreading the right message. Mm-hmm. And as being vigilant like that and staying safe like that is going to contribute to safer communities, and it's going to help mitigate the virus.
Any tips on enlisting community members to be an active part of this solution? Especially, we've passed Thanksgiving. Now we're coming into the Christmas, December holiday season and beyond. How do we? Our community's tired too.
Yeah, and we have we have our health departments on television every day with our governors, and they're seeing the same faces every day, and it's almost like Groundhog Day for some people. But we keep repeating the same message about safety and staying vigilant. And one of the things that we did in Pittsburgh and Western PA is, everybody competes for resources. For me, resources are nurses. But between our CMOs, our chief medical officers in Western PA, and our chief nursing officers in Western PA, at all of our hospitals, we've each formed our own support group, if for lack of a better term. But we meet once or twice a week by phone, and we talk about, what are you doing in your facility? What are the best practices? What to watch out for? How can we support each other? We're not sharing staff, but we're sharing ideas, and we're making sure that we're not stepping over each other. And one of the things that both of these groups did is we each penned a letter that it was to the community saying, we are the voices of healthcare, and this is what we expect of you, because we're on the front lines. We're seeing what's going on. Please be vigilant. And we got some great response from the community on that, because, personally, the nurse leaders and the voice of nurses, being the most trusted profession for 19 years in a row, people listen. They listen to nurses, they listen to physicians, they listen to caregivers. And that's one of the things I think has been very effective for us in our community.
One last question. We're fortunate. We're seeing new therapeutics, and we're seeing a lot of buzz about vaccines. The Pfizer and Moderna vaccines probably just around the corner on the horizon. How are you educating and communicating with staff about those vaccines?
So we're very excited about the vaccine. We also careful not to say it's the magic bullet and that you don't have to still be vigilant. So very much like we did COVID testing, and we stood up facilities for COVID testing, both mobile and external and in tents and places, we will likely do that with a vaccine and educate about that as well. We're of course going to follow the CDC guidelines. Our Chief Quality Officer, Dr. Brian Parker, is leading the way on this with us, and educating our staff as well as the community on what to expect with the vaccine. And again, it's not a one shot and done. We know that there's, different types of vaccines, and that we have to make sure that everybody stays vigilant, and that, they understand that the vaccine is a wonderful thing to have, and if we pair it with the right behavior.
Absolutely. It is not a get out of jail free card.
That's right. That's right.
So Claire, thanks so much for joining me today and for sharing insight on how we can all prepare and support our workforce through this fight against COVID. Until next time, thank you everyone for joining us today, and I hope you'll be back for our next and final Leadership Rounds conversation on December 14th with AHA's incoming board chair, Dr. Rod Hochman. Until then, stay safe and be well.